But we are going to start today's show off on this Wellness Wednesday by talking about your health. From mammograms to x-rays, you'll most likely need some advanced imaging in your medical future.
And why not go to the only locally owned and operated advanced imaging in Fresno and Clovis? The CMI Radiology Group has 3 locations for you to visit. And here to tell us more, we are joined by Dr. Monique Meyer. She's a member of the CMI Radiology Group. Doctor, great to have you on today.
Thank you for having me.
Thanks for being here. So tell us a little bit about yourself and what you do.
I'm a fellowship-trained neuroradiologist. I work with CMI Radiology Group. I've been working in the Central Valley since 2014. I did my medical school at the University of Connecticut and my radiology residency and fellowship at the University of Arizona. I have research experience in traumatic brain injury and CT perfusion and a published author in both of those areas. I do want to touch briefly on radiologists because I don't think people realize radiologists are actually medical doctors, and we go to medical school for 4 years, and then we do 5 years of residency afterwards in order to practice radiology, with the majority of us doing additional 1 to 3 years of fellowship training. So after medical school, you know, that's an additional at least 6 years for me. In order to do what I do.
Be a little bit more specific about what radiologists do.
So radiologists actually interpret medical exams. So when you get your MRI, your CT, your mammogram, your ultrasound, your PET, radiologists are the people who actually read and interpret the images. So radiologists are actually the physicians that typically provide the diagnosis from those medical imaging. And a lot of people think that their surgeon or their primary care physician or family medicine doctor or the emergency medicine doctor is actually the person that looks at those images and interprets them, and it's not. It's the radiologist, and you need a lot of additional training in order to do that. And so as a neuroradiologist, I specialize in reading brain MRIs and spines and the CTAs and MRAs. So
it's very impressive what you do, and especially all those extra years of training and fellowship and school. So tell us why it's important for you to be a part of the CMI Radiology Group. It's a great group.
It is a great group. We are the only locally owned and operated group in the Fresno area. We cover 3 hospitals, Community Regional, Clovis Community, and Fresno Heart and Surgical Hospital. And then we have 3 outpatient imaging centers, Advanced Medical Imaging Northpoint, and California Imaging Institute.
What patients would need to go to these imaging centers? For example, say someone's diagnosed with lung cancer. Where would they go, and what kind of tests would they need, and what would you be looking at when you look at, well, you're a neurosurgeon, but the other 30 radiologists.
That person may come to me also and have imaging studies that I would read. So depending on the stage of lung cancer and if initial staging, they might see it on chest x-ray first. Somebody might present like cough. Get a chest x-ray, they see a lung mass, they're going to get a CT afterwards to evaluate. They'll do staging with that. And then on top of that, they'll probably end up getting a PET CT to see if it's metastasized anywhere else. That means like gone to the bone, liver, somewhere else in the body other than just in the lung. And I would step in on the point where they'd probably order an MRI or CT of the head, and I'd interpret those imaging to see if it's gone to the brain.
Wow. What's so impressive about your group, it's about 30 of you guys, and like you said, you're all MDs, and you're super specialized here. I want to just mention, though, that your advanced imaging is not, there's some other groups in town that are advanced, but you guys are not them. You are the only locally owned.
Correct. So there's a recent group that bought out some imaging centers here in Fresno, and they added advanced to their name, and we are the only locally owned and operated imaging centers in town.
And you have a lot of machines that you you can provide these scans with.
Our outpatient imaging centers have 5 MRIs, 4 CTs. We have ultrasound, PET CT. We have interventional radiologists that do outpatient procedures at one of our sites. Diagnostic X-rays, fluoroscopy.
What is that?
Fluoroscopy. There's certain studies where you drink barium and we watch under fluoro, which is kind of an X-ray machine, and we in real time look at like your esophagus or barium enemas, which is probably a little more detailed than you want to for live TV. But yeah, we do fluoroscopy, hysterosalpingograms.
Wow, you do it all. And I know you have state-of-the-art equipment. And I like how you mentioned there's also a women-focused location. Can you tell us about that?
Advanced Medical Imaging Northpoint is our most recently opened outpatient women's imaging center. It's where we do ultrasound and mammography. They also do diagnostic workups there. It is a beautiful imaging center. It has a spa-like setting. We've gotten a lot of compliments about it from our patients, and it is beautiful.
Yeah. Well, and it's nice to know that, because anyone getting any of these done or any of these tests done, it can be very intimidating, these big machines, and already they've been diagnosed usually, right, with something that's pretty serious. And so to have a relaxing environment like that, I think would make it so much better, right? The experience. Yeah.
It certainly does, and that's one of the reasons having a nice facility is actually really important. It reflects positively to the patient, and it also reflects positively onto the patient that we are so well organized, and it's just a nice setting.
Yeah, and especially to know you've got the best radiologists and doctors in town that are ready to treat you. So folks, please head over to CMIRad.com to learn more about all their facilities and all the services that they offer. 25 years of experience. You guys really do it right.
Yeah.
Thanks so much for your time today, Doctor.
Thank you for having me.
Thanks, Doctor. So interesting, so interesting.